My name is Susan Voss, and I'm the Iowa Insurance Commissioner. I've been commissioner for 8 years, but I've also been in the insurance division for almost 20. And in the entire time that I've been a regulator, one of the hottest topics we've dealt with is healthcare. In fact, when I started in 1993, we were talking about healthcare under former President Bill Clinton. Do you remember we were talking about putting together some way to get people access to healthcare? And in Iowa, we were talking about ways to help folks who had pre-existing conditions or illnesses or issues within their medical history that barred them from getting coverage at affordable rates. We've set up a lot of different types of systems to assist Iowans to get coverage, but at the end of the day, we've continued to have challenges with costs and even challenges with getting a coverage that makes sense for people in various parts of the state. In 2010, the Affordable Care Act was passed, and I know you've read a lot about it, whether pro or con, but one of the issues that Angie and I are here to talk about is the exchanges and what's currently happening and how do we think that may benefit you on a number of levels. First of all, I want you to know that if you already have health care coverage, you are not going to lose your coverage just because the exchanges will be set up in Iowa. If you like what you have and you, for example, if you purchase coverage on your own, you're not going to be forced to drop your personal coverage and go into an exchange. But the exchanges under the law have been created to allow sort of for one-stop shopping. So people can go to one place and determine what coverage is best for them. For example, there may be people out in Iowa who actually would, based on their income and circumstances, would be eligible for Medicaid. This system will allow them to figure that out immediately and they could become Medicaid eligible. Or there may be other types of private insurance that you may be eligible for that you didn't realize, and you would also be eligible for some kind of tax subsidy or assistance. The exchange will automatically help you determine what that subsidy would be. In Iowa, the subsidy is pretty generous. It's 400%, up to 400% of the poverty level, which for a family of four is about $80,000. Now, the exchanges go into effect in 2014. So as you can imagine, there's a lot of work going on behind the scenes, and the Department of Public Health, the Department of Human Services, and the Insurance Division have been working very closely on trying to determine how we would create an exchange, which would have a 1-800 number and assistance to help you determine where best to find your coverage. We're in the very, I would say, preliminary stages right now of setting up that exchange. A lot has happened over the last couple years. We had a U.S. Supreme Court challenge where the law was upheld, and we have to meet certain deadlines in order for the state of Iowa to have its own exchange system. And so we're discussing how we're going to make that state-based exchange work. But right now, because I can't tell you where it will be located and how it will be located and who's going to run it, I want you to note that on our website at the Insurance Division, www.iid.iowa.gov, just Google us at Iowa Insurance Division, we have a template that's available that shows you everything that's going on in healthcare reform right now, what has been implemented, and what additional tools we need to get in place for the exchange to get up and running. So I guess I would much rather hear your questions, and I know Angie wants to share some information, but one thing I just want to pass along is if you are purchasing your own insurance now, you are not required to drop it to go into the exchange. If you don't have coverage or your employer doesn't, this is an opportunity of a way to get coverage. And if you qualify for a tax subsidy, you can get the tax subsidy through the exchange. Now, one other part that I wanted to mention that your organization has been very active in is the issue of navigators. Under the federal law, it allows for what we call assistants or navigators to help people purchase insurance. You don't pay them a fee, they get paid through the exchange. And a law was passed last year to set up the guidelines to create these navigators. We haven't really done anything with the law yet because we really still don't know how we're going to set up the exchange. But it's very possible that you could help get your insurance, not through an insurance agent, like we typically know somebody that you buy your auto or your homeowners, but you could go to a navigator, somebody who has been trained on health insurance and can help you navigate the system to get the right coverage. And you don't pay them a fee, it's paid through the navigator. Are any of you familiar with the Senior Health Insurance Information Program, SHIP? Okay, which is in our office, by the way. This is a similar type of program, like the SHIP volunteers. They don't get paid, but they're highly trained, and they will help you get through the system to get the right coverage. So as soon as we figure out how we're going to do that, we will let John Hale know. And by the way, you have a great advocate in John Hale up at the Capitol. He's done a wonderful job. We really appreciate that. So I know he's not here, so I could say some other things about John, but I won't. But in any event, there will be assistance throughout the state, a 1-800 number, and sort of counselors to help you determine if that's the best way for you to go when you get your health care coverage. So I'm going to let Angie talk for a little while, and then we can answer questions, but please feel free to call me at any time, and we will help you get answers to your questions.
I'm a mother of 4 boys, so usually I don't need microphones. I'm pretty good at talking loud and yelling, but it's a pretty big room, so we're not going to challenge me this early in the morning. So, good morning. First of all, the term exchange, it sounds so complicating and intimidating, doesn't it? Sounds like something you're going to go and buy stocks or something with. Well, that's one of the first things that we want to ask our consumers out there is there something else that makes it more tangible to you? So if you guys think of something some of the states are asking about marketplace and other different titles, if you guys, people who will be accessing that exchange, if you can think of a name, a title that would be better, please let us know and we will take that into consideration. I think branding this complex system is something that we need to, as we talk about outreach and education, take on as one of our first priorities. Because generally when we say exchange, and we found that out in these focus groups I'm going to talk about, people's eyes just kind of cloud over. So please, again, we will look at consumers to help us brand this as we move forward. Okay, and I also wanted to point out a couple of the handouts we have for you. This is kind of a 101 cheat sheet of what an exchange is to make it a little less complicated. We also have, Susan talked about the subsidies. Here is to make it very easy to understand. If the exchange moves forward as it is right now, this is how the incomes will look. Abby handed these out earlier. They're actually not in your packets. We just put this together yesterday. It will be on the second half of this eventually. So the 200 to 399% of poverty, and there's going to be some, little details that people can fall in this gap or that gap or everything. But for the most part, this will show you the tax subsidies. The tax subsidies will be instant. So when you go in and start to put in your information, it will be up front, your tax subsidies. So you can see in the peach in your income, if consumers' income falls in the peach, the pink, and then the purple there. So that will, I think, makes it a little less complicated too. One of the things that we realized is that we need to have the consumers buy-in. If we can create a system and we can create an outreach plan, but unless we have that consumer buy-in on it, that could just, people won't listen. So what we did is we did regional meetings and focus groups across the state to try to do that. The regional meetings were for businesses, people who may have financial interest in how this is set up. The focus groups really were supposed to be the consumer's point of view that had no interest in it except that they wanted insurance. So we did these across the state. Your guys' association, members of the association, we actually had one specifically with your members. You will see in your packet another piece here, and this really is a summary of those regional meetings and focus groups. But some of the things that were really said at your focus group specifically that really made it tangible and helpful to us, we asked you, how do you want to access it? And we heard everything from we want to be able to go online like Amazon, never talk to anybody, never do, just go in and decide what we want. All the way to, I want somebody that I can go to the library with and help me through every step of the process. So that is important for us as we plan forward, that there are different levels of comfortability with this process, and we need to be able to cater to all of them. Outreach. We were heard loud and clear that we should have already been doing outreach before we even did the focus groups. So we are definitely behind the game on that, and we are creating an outreach plan as we speak to make sure that when this is up and going, we also have that other element out there. And trust. I mean, am I going to trust this? Am I going to be able to trust you to put my information in there and it to stay safe? So that is another very important element we have to think about as we move forward. One of the most tangible and great suggestions we got at the focus group with your members was, if you want me to trust it, I want a seal of approval. And we had never heard that, and that is great. We want a seal that says, you're telling me I can trust this vendor, I can trust this website, I can trust these outreach coordinators. So that's something definitely for us to think about as we go forward. Again, one thing I want to let you guys know is that the exchange does seem very complicated, and really it is. I'm not going to lie to you, it is complicated, especially when we start bringing in the public programs like Medicaid and Hawkeye into this eligibility. DHS is having to completely redo their IT system to be able to accommodate this. But the most important thing for you guys is that it may be complicated to us, it should not be complicated to you as we move forward. This should be a system where you can go in and it is seamless to you. And that is really our priority as we move forward for this. So I just want to assure you that while this is a very complex issue, in the end, when it's all done, I hope it does not seem that way for you. Hopefully we have a great outreach campaign with a great seal of approval and a good IT system where you guys can go in, and this should be easy. Okay. Thank you again for your participation in this process. You guys really gave us some great information as we move forward.
We'll take your questions or on anything. Anybody have any questions about healthcare delivery? I think this next year, 2013, you're going to see a lot more information probably becoming public as we make some real determinations on how we're going to set up the exchange. We have to really start enrolling people next October 2013. That's like a year away, so we're moving fast. Yes?
Okay, to clarify, are you talking about the government, the United States transition over to everybody has to have health care?
The question is this the government's transition where everybody has to have health care? This is part of the law that is trying to get coverage for everybody, which includes, the issue of the exchanges, and also, for example, if people don't purchase some type of insurance, then they have to pay a penalty or a tax, as the U.S. Supreme Court said. So this was part of a way to get coverage to everybody in more of a seamless way to get that coverage for everybody.
Okay. I just want to add that the exchange is actually the vehicle. It's not the enforcer. It will be the vehicle to make sure that people have access to insurance.
What are you going to do with the people that currently are living, barely putting enough food on the table to feed themselves, and they can't afford to buy the health insurance? Even at let's say it costs $14 a month. What if they can't afford that?
Now the question is, what if people are living paycheck to paycheck and can't afford it? The law now allows, did an expansion of the Medicaid program for adults without children, which was a way to get to the individuals who did not meet certain, that didn't meet the income guidelines. Now, the governor has not determined whether he's going to do the Medicaid expansion, but the law as it's written now, that was passed by Congress, if you do not have enough money to pay for private insurance, you would qualify under Medicaid. So you would not be paying a premium.
What I've run into in the past is I've been told, I'll use myself as an example, is I've been told I made too much money for any type of assistance, but I had enough bill because all they counted was my income. They didn't take into effect my bills that I have, my medical bills from the past, And, they may look at my rent, take in effect, or in account my vehicle payment that I have to have, and insurance on that I have to have.
So under the new system, we're looking at an expansion of Medicaid, so depending on your income, that may change that you would qualify for Medicaid. In addition, now with the subsidies under the exchange, you may have a certain income, but you may be eligible for the tax subsidy, so that would lower the actual cost of your coverage.
I think it's important that, again, we can go back to this graph here. And as Susan said, a family of 4, that's $80,000 a year. And we're used to working with demographics. $80,000 a year in Iowa is a lot of money. There's only going to be a small percentage of people who are over this 400% of poverty. So if you fall under that 400%, it's either going to be free insurance or very low cost insurance. And that's what this, that is what this was designed to do, is to help families exactly like you to make sure that they can insure their families.
I was just wondering how this will correlate with the HIP Iowa and the HIP Fed programs. I had a pre-existing condition, which I didn't know until I applied to the second company, and they told me they couldn't insure me because of that. And they directed me to HIP Iowa and HIP Fed, which I guess are kind of separate programs, and you have to kind of look at them and see what would suit you best.
You're right. Actually, those programs will go away because in 2014, companies will no longer be able to exclude you because of a pre-existing condition.
So then where does that leave me?
Are you in the HIP Iowa Fed or the HIP Iowa?
HIP Iowa Fed.
Okay, then you just go to the regular market. I'm not sure if we phase you out on that program. We wouldn't accept any new applicants, but then you could just move right into the open market at the average rates, which I think you're probably paying right now.
Well, there was a chart,
Right, you won't.
and it was significantly lower than what the other companies I applied to. They wanted me to pay $700 and some
Right.
dollars, and I think I'm paying about $520 right now.
Now, what will happen is, you see, every company will be in the exchange, so you'll have a wide variety, of what we hope, of companies, other than Wellmark, to buy coverage from at the average rates with everybody with no pre-existing conditions.
Do you think that the program I'm under right now is going to be sending me information out, or the federal?
I'm sure they will. We sit on that board. And I'm sure everybody who's, I think right now there are 350 people in your program, they'll all get a notice.
My mother-in-law went to the nursing home a few years ago, and she had some special insurance that she acquired through her husband, who was a veteran. And why, when somebody applies for these different insurances, we actually had to go through a lawyer to straighten everything out? Why does it take so long for people who have earned their benefits to actually get them? This was 3 years ago that all this started. 3 months ago, she finally started getting the benefits that she earned.
Are these health care or long-term care?
They're long-term care.
Well, that long-term care is a different program altogether. Why don't you can call me? But if it was we don't have jurisdiction over some of it. Was it a government such as veterans?
It was veterans.
We don't, sorry. Thank goodness I don't have authority over the federal government benefits. But we would be happy to, assist you in any way we can. But yes, sometimes the long-term care benefits take much longer to access. We've tried to make some changes in that, but that's a very difficult area.
Thank you.
Sorry.
Years ago when my father had a stroke, it was difficult to get him insurance. Is that going to be?
That's all going away.
Sorry?
That's all going away.
That's all going away, so there'll be no.
Well, let's put it this way. You go into, let's say you don't have, in 2014, you don't have insurance as of January 1. You get diagnosed with a stroke or you get diagnosed with cancer, you can go in and buy insurance and there's no pre-existing condition waiting period. No exclusions.
Is it going to be more expensive for the pre-existing?
No, everybody's in the same pool. There's no discrimination on your rating. You know, everybody's going to be in the same pool.
For instance, I mean, Di asked us to comment on some of the other things. The insurance that will be sold through the exchange will have to meet a certain benchmark of what is offered. Some people think it's very robustly comprehensive. Others would argue that it's not. But I would say that it is very comparable to what we probably have today. Your children will be able to be insured, I think many of you know that, up to the age of 26 now in their parents' plan. The other important element on insurance that will be sold within or without, outside of the exchange is most preventive care will be covered without a deductible.
Does this include medicine too, or?
Yes, drugs are included.
But for instance, women used to be able to be considered high risk just from being a woman, because you are more likely to get pregnant even if you're 50. Please, let's not let that happen.
Although sometimes I wish they could.
Yeah.
Sorry, man.
No, I'm raising 4 boys, let me tell you, I love it. But anyway, so, but that is another thing, that in being a woman, we no longer will be able to be discriminated against as we buy a plan. So there are lots of different elements, even outside of the exchange, the ACA is supposed to address on a lot of the issues and questions that you guys are asking today.
And there'll be different levels of the plans. They're called precious metals. So if you don't want the richest, okay, we have 5 minutes. If you don't want the richest plan, there will be other plans available with fewer benefits, but there is a baseline benchmark plan.
Okay, my question is on my husband. There's already so much, there's already people struggling who are on Medicaid, who, and there's already problems with like trying to support people that are already on Medicaid. If you're going to add all these new people in, how are you going to be able to support that?
Well, the law currently says that 90% of the new Medicaid costs will be paid by the federal government, and no, I think it's 100% to begin with. No,
I think it's 90.
it's 90%. Sorry, and then the states will pay the additional 10%.
Where are they getting that money from to support that though?
It's kind of beyond my pay grade. That's kind of up the food chain at the federal level, but that's what the law says right now.
Thank you.
The exchange, now, is it for just the uninsured, or can people apply for secondary insurance? With the individuals I serve, they still have medical bills after their insurance has gone through. Now, can they apply for, another secondary insurance to help assist that with payments?
Well, under the new law, there's no lifetime maximums. So I'm not sure why you would buy a supplemental policy. It would be different outside of Medicare and Med-Sup policies, which are different. We put those in a different category.
This is about health coverage. My grandson had a part-time job, and he didn't qualify for the insurance benefits there, but he doesn't qualify for Title 19 because he's 19 years old. Is the HOC one going to raise their age standards?
Well, first, if he's 19 years old, then he will qualify with his parents' plan now. I'm sorry? Okay, I'm sorry. She asked, she has a grandson that currently does not have insurance and wants to know if the Hawkeye program is going to raise its age. Well, what I can tell you right now is the Hawkeye program goes up to 300% of poverty, and Medicaid will also go that high. So, and Medicaid does go up to its ages will be lifted. So if he, right, I understand. No, under the new guidelines, he will most likely qualify for Medicaid in 2014. Unfortunately, until 2014, a lot of people are kind of hanging in limbo.
Okay, right now on some of our insurance, I know we have to have referrals for specialists and stuff. Is that going to have to continue? And the co-pays, will they be higher?
You know, I can't speak to the referrals. I know there's a lot of discussion about what kind of policies, once we have the benchmark, which hasn't been determined yet in the state, and then what the precious metals. We have to see a lot of the co-pays will go away depending on if it's preventative care or not. So we haven't quite figured that out yet.
Okay, is this insurance company, I work in the hospital, and I'm seeing so many times that the hospital or the insurance company denied payment because of the diagnosis. Are they going to have to?
There's There's a new law that requires that if there are denials because of diagnosis or experimental or medical necessity, those can all be appealed. We already have that in Iowa. So if somebody's denied coverage or payment, they can appeal it to our office and we'll review it.
And that's why Susan gave you her phone number.
Call me. Call me. Thank you.